simply speaking, the principle of community engagement is to think about the fact that the community has to be involved in all the aspects of the research that we do. So they have to be considered when we consider thinking about even starting with the questions of the clinical trials that we want to conduct. The question has to be, what questions should we be asking and what should we be investigating that meets the needs of the community? Ultimately, what we want to do with our clinical trials is significant scientific discoveries that will meet the needs of the community that we serve. I am Dr. Flakemi Odedino, and I am professor in hematology and oncology, as well as I have the honor of serving as the enterprise-wide Deputy Director for Community Outreach and Engagement within the Mayo Clinic Comprehensive Cancer Center. The title of the article is Community Engagement Strategies for Underrepresented Racial and Ethnic Populations. And I co-wrote this article with Dr. Mark Wheeland, Dr. Kim Babel-Johnson, and Dr. Jennifer Crook. The real cross and the real implications of the article is for us to be able to look at, number one, how do we address the lack of diversity in research and lack of inclusion and lack of representations of minoritized and marginalized communities within clinical trials. And we really make the suggestions very strongly that investigators really need to understand and address the challenges of clinical trials participation by minoritized populations. One of the things that we highlighted in the paper has to do with what exactly are some of these challenges, what facilitates clinical trials, and what sometimes causes the barrier for clinical trials. And we clearly delineated not only individual level barriers, but we look at what could be the investigator level barriers, or what could be the protocol level barriers, or what could even be the health system level barriers that we need to address. We talk about the idea of having a clearer understanding of the balance of power between researchers and community partners, that this is very critical in any approach that we want to take in making sure that we have representation in clinical trials. And we outlined specific things that could be very helpful to investigators, from asking yourself, how do I identify the community that I need to partner with? How do I ensure I have the right partners from the community to work with? And once I have the right partners, what should be the process of working with the partners to ensure representation within this community? And also, when we are conducting the study, what are some of the considerations to kind of think about when we're doing this? And finally, when the study is ended, how do we make sure that the study results are disseminated to minoritized and communities and also marginalized communities in partnership with community partners? So these are ways that we have to really, really consider. Overall, one of the takeaway is we want investigators to really have careful consideration and very honest reflection about what does it take to really have a way of working hand in hand with community members in ensuring that their priorities for clinical trials are well represented in the questions that we ask, and then to ensure that we are working very closely to make sure that they are represented in the research that we have. And once the research is conducted and we have done it in a way that really fosters partnership with community, to make sure that we're not only disseminating the results in the scientific journals, but we are disseminating the result back to the communities. I've only been at Mayo Clinic for a little bit over 2 years. And one of the things that really amazes me about Mayo is that we are not just talking about representation with clinical trials, we are actually taking the right steps to ensure that we are working with partners across our enterprise, whether it is in Florida or whether it's in Arizona or whether it's in the Midwest, to make sure that the community is represented in everything that we do. A lot of people do mouth service and talk about representation, but not every institution thinks about the idea of how do we make sure members of the community are part of our research team? How do we make sure we empower the community by actually providing an opportunity for them to be a trained community scientist or citizen scientist? One of the other things that we do at Mayo Clinic is actually inviting the community to come and see a lab and to come and see the innovation and to come and see what we are actually doing with the data that we have when they're participating in clinical trials, or the samples that they donate for clinical trials, to see how this is actually helping now with science and how it's helping to have a precision intervention or to target intervention that is better for them. I think this is really a great approach. Apart from taking the steps in using community engagement research, there's also funding through Mayo clinics that allows us not only for us to work in this area, but also to fund community members who really want to ask their own research questions and work collaboratively with us. So I think the commitment, providing funding not only for our investigators, but also our community members, making our institution a place that all community members are welcome to come and really see firsthand about what we are doing, is an approach that I think is really great. One of the other things I'm really very proud of that Mayo Clinic is doing again is the decentralization of our clinical trials. A lot of times, some of the barriers that people experience in participation in clinical trials has to do with the fact that they are not able to come to the institution, or they have one or two social determinants of health factors that may impact them. So for example, transportation, or for example, access to care. But by decentralization of clinical trials, which means we are taking the trials to people within the community, or we are taking the trials to their home, Mayo Clinic is actually leading in this area for us to really meet community members where they are, and to ensure that we are breaking any barriers that could stop them from participating in clinical trial. I think this is very unique of Mayo Clinic, and this is one of the things that we are leading in the innovation of decentralization of clinical trials. As we go out, and as I go out to talk to members of our community about clinical trials, one of the things that I tell them, whether you participate or not, the interventions, the drugs, the devices, anything that comes out of clinical trials, you are still going to have to use it. You're not going to ask the question, was I represented? I, for example, as a Black woman, did a Black woman participate in the study? I'm not asking that question. Immediately, I need that drug, I need that device, I need that cream. I'm going to use it. I'm not going to ask that question. But you have to ask that question, that were you really represented in all these interventions of therapies and devices that now you have to use? And this is one of the reasons why the findings of clinical trials has to be related to you, to your population, and it's very important that you participate in clinical trials. It's really, really important for patients, but not only for patients, for community members at large. Because guess what? Those findings is what allows us to develop the interventions, the therapies, the drugs, the devices, the cream that is going to be used for us. One of the things that we struggle with in the United States, not only in the United States, but across the world, is to ensure that people who are from minority, or who are from underserved, or who are from rural, or who are from health disparity populations, that they are represented in clinical trials. And if they are not, then it really contributes to disparities that they experience itself, because the results that we get from those trials may not be applicable to them. So our article is very significant in being able to lay out, these are some of the strategies that we need to take to be able to ensure that we have the representation that is required for racial and ethnic populations to be part of clinical trials, in order for us to be able to close the care gap, eliminate disparities, and achieve health equity overall.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.